Hello, my name's Ami Banerjee. I'm Professor of Clinical Data Science and I'm also a consultant cardiologist at UCL, and I'm leading a program of work in research in long COVID called STIMULATE-ICP. Today we're going to be talking about the financial consequences and the cost to both individuals and society of this relatively new illness, but now already 2.5+ years in. And I'm going to be discussing this with members of our patient and public panel in the STIMULATE-ICP project. So if we could just get everybody to introduce themselves, could we have Anthony and Claire first?
Hi, I'm Anthony.
I'm Claire. Hi.
I'm a former journalist, author and war correspondent. Claire was a former, well, it still is, but...
I was a specialist nurse, and yeah, I'm 53 now. We caught COVID in December, January 2020. A long time. So we've been...
And that went on to long COVID. We both lost our jobs and careers as a result of our illness, and we've gone from a reasonable middle-class income to exclusively relying on benefits for all of our income now. So we'll be talking a little bit about that, but that's enough about us for now.
Thank you both. We'll definitely be coming to you shortly. Can I go to Mag next?
Hello, I'm Mag, and I'm delighted to be here today talking about finances. I got COVID in July 2020, and it is an up and down journey, but I feel great strength from being in this group and being able to share things with people who understand the experience without having to over-explain. So I'm very glad to be here, and I hope that we can help somebody else on the journey of long COVID, or help somebody who's supporting someone with long COVID to just shed some light on the experience. Thank you.
Thank you, Mag. Can I go to Kim next?
Hi, I'm Kim. I've had long COVID since March 2020. I've been lucky enough to have quite a supportive workplace, and I'm able to work from home now. But there's a lot of uncertainty about not knowing what's coming down the line, about sort of not knowing how secure your job is. So I'm going to be talking about that as the discussion goes on today.
Thank you, Kim. And we've managed to get two Rachels on the call, so I'm going to go to Rachel W.
Hi, my name's Rachel. I am a carer for my husband Andy, who has got long COVID and has had long COVID since January 2021. He was a key worker and a carer, and he has also lost his job, and I'm just working very part-time at the moment because I'm looking after him and also our son. Thank you.
Thank you, Rachel. And last but not least, other Rachel.
Hi everyone, my name is Rachel and I am a registered nurse. I contracted COVID in October 2020 while working on a COVID ward. I'm here to talk a little bit today about what some of my colleagues are going through now that the NHS pay changes came into effect on the 1st of September and what that means for us.
Thank you, Rachel, and thank you all for giving up time to share your experiences. So let's not forget that the Office for National Statistics has currently estimated that about 2 million people having 12 weeks or more symptoms of long COVID. So remember, long COVID is defined by the World Health Organization, 12 weeks or more, and there's over 500,000 people who have had the symptoms for 2 years or more. So this is a large number of people with long-term disease, long-term impairment, and that's what we're talking about. I wonder if, Anthony, you could start us off, you and Claire, just telling us a bit about how that's affected you both from your point of view.
Well, I think it's fair to say that long COVID has robbed us of everything that we held dear in our old lives. So we had a reasonable standard of living. We were both professionals, both working, both very active and happy to step outside of our comfort zones. But when we got COVID and then long COVID, very quickly we ran into problems with income. We had savings, but we burned through those while we were waiting for benefits. And that's something else I'd like to talk about, is the benefit system isn't fit for purpose. It seems to disenfranchise and exclude those who need it the very most. It's overly complex to apply for. In our case, it needed an advocate to complete the forms for us because they were just beyond what we were capable of doing when we were at our worst. I worry also about the economic impact that this is going to have on our economy. If you look at gross domestic product, or GDP, you look at us as an average and the fact that we are no longer contributing to the treasury in the form of paying tax or national insurance. We're taking from the economy because we're taking benefits. We're not spending, so we're not contributing to the growth in GDP. And if you look at that across, the ONS say that there are 2.5 million people over the age of 50 that have dropped out the workforce in the last 18 months. That is going to have a huge impact on society and on government because of the huge reduction in net tax receipts. And that's not to mention the economic impact on individuals like ourselves, where benefits are supposed to be linked to the rise in inflation, and the government at the moment can't even confirm that, even though the manifesto promises to do that, they're looking at cutting it. So
it's left us in a state of financial flux, really. We don't have much. We've got a mortgage, a small mortgage now on the home we live in, but obviously the benefits don't cover your mortgage. So we're scrimping and scraping money together each month when the mortgage is due. And just the uncertainty of, we're currently in a cost of living crisis. Fuel bills particularly have doubled and trebled in the last couple of months. And yeah, so there's a lot of insecurity related to financial matters. And it's, nobody, I don't believe anybody ever wants to live on a benefit subsistence allowance. Nobody would choose that voluntarily. Yeah. But we might look all right today, but actually I spent a lot of my time bedbound, and so it's a good day today, but I'm often not able to read, so filling in forms is tricky to understand. The cognitive impairment of long COVID makes it very difficult to keep tabs on your financial incomes, outgoings, and filling in forms for benefits and stuff was, like Anthony said, it was impossible for me. But luckily there is help available. So your GP may well have a social prescriber attached to the surgery who can put you in touch with an advocate. Basically, they're just a helper to help you understand and fill in the forms. They can do the forms for you. For example, my personal independence payments, PIP, you might have heard about, which is a disability benefit. the forms for that were filled in by an advocate. She spoke to me on the phone on about, I don't know, 7 or 8 occasions. We spoke for just 10 or 15 minutes because my cognitive impairment, my physical health was so rotten at the time that anything more than 10 or 15 minutes on the phone would send me crashing into horrific migraines and awful. She managed to get our PIP application done, so it made things a bit easier, but you still have to get out there and find the people to do that for you. But your GP surgery, if they have a social prescriber, they can put you in touch with an advocate. The Citizens Advice Bureau, they do a lot of form filling for disabled clients.
And Dial,
the
disability charity have been brilliant in supporting us and helping us with benefits and stuff like that. So for anybody that has never, like us, never navigated that before, it's really helpful to have somebody behind you that is familiar with the process, with what they're looking for and how to get the benefits that you need first time, without having to appeal, or
because we'd never done it before. We didn't know what we were entitled to or how to go about applying. So having these experts, the Citizens Advice Bureau, Dial, and your advocates, social prescriber and the advocacy assistants, they're really invaluable for people like us who haven't come across the system before and don't know how to navigate it.
Thank you both. That's both a very harrowing account, but also, you know, it's great to hear that you've found some ways available, and thank you for sharing that for our listeners as well, of how you can get help. I wonder if I could open to others now. Claire has and Anthony have both said very, very clearly about their previous work and how it's affected them. I wondered if the others who've been in frontline work previously or currently, how you know, the financial implications and the bigger picture affects them, but also how they see that affecting, you know, whether it's health service, social care as well. Maybe if we could go to Rachel and Mag, and then feel free to chip in, others.
Yeah, I mean, so I'm a member of NHS staff, and it's been really interesting watching this situation unfold because it's been very different across the 4 nations of Great Britain. Different dates, you know, so for instance, my Welsh colleagues were receiving a lot less pay in the NHS much earlier than I was in England. So as it currently stands, from the 1st of September this year, the COVID special pay that was paying people like myself off with long COVID, most of whom contracted it at work, came to an end. So there's been several petitions started, you know, so for instance, there's one going to reinstate the COVID special pay, and that's reached nearly 167,000 people have signed that already, which I think shows a real view of how people are feeling about it. There's a new key worker petition, so not just NHS staff, because we're seeing now that it's obviously such a wider issue. A lot of people with long COVID are going towards ill health retirement when their workforces and employers are starting to think, right, okay, it's clear you're not coming back to work. But what's interesting about ill health retirement is most people with long COVID are not getting it. I think there isn't a case in the UK yet who has been awarded it. And interestingly, you cannot come back and claim in the future. So even when long COVID perhaps has more research and maybe a bit more of a time frame of how this is going to go for people, you can't come back and reclaim for it.
Can I just interject? I know Claire successfully was awarded Tier 1 ill health retirement under the NHS pension scheme, but we're appealing that at the moment. And
can I just say that it's been a nightmare getting that done, that my employers put a lot of pressure on me to go for ill health retirement rather than dismiss me, but the NHS pensions was under quite a strain at the time, with lots of people in the same situation as you and I, Rachel, and so they it took a long time to go through. I think we applied in January. The decision came through in what, May
this year.
Yeah, May. So I'd already been dismissed by my employers and was still going through with NHS pensions, because they say that I'm only on, I can't remember which tier it is, tier 1 or tier 2, and some medical professionals have suggested that given the severity of my symptoms and the limitations on me since long COVID, that it's debatable whether I would be able to find any regular employment. So yeah, getting that, even if you do get your NHS pension awarded and are allowed to retire on ill health grounds, it still is such a battle. If you're ill already, it's very difficult to navigate.
Our issue was the fact that the physician who assessed Claire's medical evidence knew nothing about long COVID, because tier 1 is awarded if you're unable to do any job in the NHS. Tier 2 is awarded if you are incapable of doing any job. And it raises the question, getting tier 1, well, what kind of job does he think Claire could do?
And this is it, it's all these things. So this, along with PIP, it's complicated because it's opening a massive chasm of people that don't really fit into each little category. I think it's fair to say that COVID has been the mass disabling event of our generation. And you're getting people, so for instance, here's a statistic for you. PIP is actually done by a private company for the Department of Work and Pensions, which have targets on how many they award. I mean, that surely is morally wrong anyway. But for instance, 10% of people who go for PIP are awarded it at the first attempt. Then they have to go through something called mandatory reconsideration. So you've already had this horrendous, torturous paperwork that, like yourselves, often need advocates or somebody to help you with it, taking weeks at a time, and is very stressful. They go to this mandatory reconsideration. 30% get it because it's awarded by the same private company. And of course, it's not in their interest to keep awarding it. So most people, if they've even got the strength left to fight it, go to tribunal. And at that point, where there's a judge and often a panel of doctors, 70% of those people who went for it in the beginning and were declined at the second attempt get awarded it. So as you say quite rightly, Anthony, it's not fit for purpose.
I think it must be very difficult as well if you are on your own, if you haven't got advocates or anything, because it was so, there's no way that Andy could have filled in the forms if he hadn't had me to do it with him. There was just absolutely no way. I managed to put it all together and got the information from Andy, but he was just far too ill, and the brain fog and everything, it just wouldn't have happened. So I'm really aware of not everybody else, either they might have a partner who's got long COVID, or they might be on their own, and it must just be soul destroying.
I think I would have just faded away in my bed and just died up there, and the house would have been repossessed around me, because I was nowhere near able to. I mean, I'm pretty good today, as you can see, but for a very, very long while, it's only the last few weeks that I've been.
And it's really hard to stand up, I'm obviously talking on behalf of my husband, to say, I've got a disability, I'm disabled. That in itself is really, really hard to take on board.
And effectively,
and
you have to become an advocate for yourself
absolutely.
when you're at your most disabled and unable to.
So to have to take on board that you've now got a really difficult disability, and then to have to cope with the finance, it's almost like a double whammy. It's like a double kind of thing to deal with, isn't it? I mean, luckily Andy is such a positive person. I'm really blessed that he's so positive and just gets on with it. But we've got a lot of people around us, not everybody's got that, and I think that's really important, particularly if people are on.
But we are getting little glimmers of hope, which I'm really grateful for, as I'm sure we all are. So there's a group called the All Parliamentary Party Group, which is leading the recommendations on coronavirus in general, but importantly, long COVID. They are campaigning the Secretary of State to open a key worker sort of compensation scheme, because across Europe, they're already open. We are behind with this in the UK. And importantly, in the last week or two, they've opened the industrial injuries disablement benefit for long COVID. Now, it's not widely recognised yet as a disability on there. And the important thing is people can start applying for it as an accident rather than a disability, which is interesting, or as a disease. Because what that actually means is if you can time specific to your employment when you contracted it, so in my case, I know the specific patient I contracted it from, you can record that as an accident, and they are started awarding it for long COVID. It's very early days, and the idea is to get it actually as one of the recognised occupational diseases. So that in itself is great news and is moving forward. But what it does once again highlight is that this is only for people who can specifically say, I know I got it from this person at this time. Lots of us do not know that, do we?
Not just that, Rachel, but you know, it's open to the people who've got the energy and the brain power to find out more about it, fill in those forms and so on.
Yeah.
Mag, can I go on, Mag? I was about to bring you in.
I was just going to say, and the energy and the brain power, as we all know in this room, is very variable. So, you know, from my personal experience, I was a contractor, so I was self-employed, and I used to go to different tech companies and work for them, and I had a really lovely career, and I actually loved it. You know, so I can't do now the thing I loved. And it was funny, yesterday I did the React Imperial College questionnaire, and you know, it's such an identity shift. I'm down in the 0 to 50% percentile for some of those. Like, that's not my norm, and it's a real you know, it's a shift in my cognitive ability. I'm sure you've all experienced. We're not as clever consistently as we were before this disease. However clever we were, we're a whole range of humanity. But you know, when we think of all the challenges we face about even supporting ourselves just to get by financially, but then when we're trying to, you know, get back into a job as we progress in our illness, it's not always a linear line in one direction. You know, it's kind of like a stock. Hopefully, if we're lucky enough, and we have all ranges in this group, you know, from, like, I feel like I'm on a really the good end of things. Like, Claire, we've hardly seen you for the last 6 months. You know, you look great today. You look like you could go out and run a marathon. That's not the true story.
We couldn't run a marathon, but I can walk to the hospital and back.
You could walk to the post office. But like, so we can't show up consistently. Like, Kim, you're working from home, and you know, today you might have a great day. You might do 4 hours work. You might have enough to make yourself dinner, and you might go to bed happy. Sometimes you might do 2 hours work and you'll suffer for it for 2 days. Like, we can't consistently show up. And the kind of employers we have to have with this disease, they have to be like super people. They have to be really empathetic. They have to have, you know, robust businesses in place. If the government isn't dictating this, you know, you're really the luck of the draw. And the one thing I will say, for this is just a very small group, but for anyone who's contracting out there in the world, make sure you have critical health insurance, because honestly, if you're the sole income provider for yourself, that's a really risky place to be. And as you said, Rachel, doubly, you know, there are a whole range of people, even in our group, who are in different situations. They're renting, or they're single, or they have a partner. And then the pressure we put on them, if people are lucky to have a partner or inclined to, you know, that's a strain on the relationship. It's a financial strain. They have to become our advocates. They have to become our carers. Like, you know, that changes the dynamic. And we're like constantly carrying all of this as well around with us, as well as the financial burden that, oh my God, I have to show up at work if I'm working. And, you know, how much is in the other person to give me the leeway I need to just get through my life. We're not talking about flourishing here. We're just talking about getting through one day and then the next day. So the financial thing, there's a lot of feelings in there as well, isn't there? there's the sort of going from one state before to the state now, the acceptance. It's a grieving process as well. It's, you know, the denial, the bargaining, the grief. It's a big old mess. Kim, what have you got to add?
Yeah, I think it's just what you said about that acceptance is finding yourself using words that you never thought that you'd use about yourself. And I recently had to explain to someone that I couldn't go into the office in London because I'm essentially housebound, and I hadn't ever thought of myself that way. And that's a really hard thing to sort of describe yourself as. And it's that process of saying to people repeatedly, yeah, I can't do that because I have long COVID. I can't do this. I want to do it, sure. And you know, there's also the aspect of if you're looking after yourself, if you're able to work, and you have to have that supportive employer who's sort of willing to accept that you know you can't work at the pace that you used to, you can't do the things that you used to, and also how willing they are to accept mistakes. Because certainly I've had a lot of times where people have come to me and said, oh, you know, you said this or you agreed to do that. Did I? I have no idea. Or I've tried to save a document that I've been working on, and I found that I've done it 3 weeks ago and entirely forgotten about it. So I might have a great day, but I might not remember that I've had a great day and done that work, which sometimes is great because I've already saved my own bacon. But other times it's, you know, I didn't realize I needed to do something. So that's really, really challenging, and to sort of try and explain that to people. I mean, if I had a piece of advice for people who are employed, it's definitely keep that conversation open with your employer about what you can and can't do, what you want to do. But also, if you're a member of a union or you have the opportunity to join a union, they will help you and fight for you, particularly at points where you're really struggling to do that for yourself. But also to ask for occupational health support if that's available. Access to Work is another government fund that's supposed to be able to help fund adjustments in the workplace to help you do your job. So, you know, it might be that you you need some you know, taxis if you have to go into the office once or twice a month or something, that would pay for those taxis. And I think the other thing to remember is that pacing, that, you know, I cook for the week at the weekend because there's no way I could do that after, you know, trying to work in the day as well. So often I feel guilty if I go out to an appointment because, yeah, I then come back and I have to rest and I can't make up the time that day at work, and that's really, really hard because I feel guilty that I should be doing this stuff. And I think that's one of the biggest challenges, is that if you are able to work, is that guilt about your cognitive impairment, your fatigue, and the amount of time that you can't do, you know, that whole sense of I can't do what I'm here to do, I can't do what I'm supposed to be doing, and the uncertainty of that, of going forward and going, I don't know if I'm going to get better. I don't know if this is as good as it gets. I don't know if I'm going to get worse, and what happens if I get worse. So there's a, you know, even if you are at the good end of the spectrum, there's still a lot to deal with
by anxiety
and get your head around.
Yeah, and the burden on your colleagues as well. That's something that a lot of us, and I think particularly in nursing, we feel it, don't we? Because we're down to the bone anyway on staffing levels. So yeah, you do feel really guilty about that.
And none of us want to be in this position. None of us put ourselves here.
None of us chose this, and none of us would wish it on our worst enemies.
No.
Well, that's where I'd like to summarise that. Absolutely, this was not where any of you thought you would be or planned you would be, and what I heard very loud and clear is about the uncertainty of the situation, not only in terms of health and healthcare, but this aspect of the impact on finances and at big picture level on the economy, which wasn't planned for. And you know, when we think back, some of the measures to kind of revitalize the economy haven't taken the impact of COVID and long COVID into account. But there is if there is a positive, that we've heard how all of you have managed to you know, seek help from places, and also there are now schemes that are meant to be starting, and if they're not, then we need to make them start. And there is an inquiry which is gathering evidence, and this should be absolutely part of it. It's not something that can be forgotten, and you know, there's so many people who've been affected, and it's important that, you know, we hear these individual stories. So thank you all for you know, sharing those difficult stories with us and your experience. And if there's any questions about any of this, then please do contact us at the STIMULATE-ICP study via our website. Thank you.